Good day. I am Dr. Larry Saltzman, the Executive Research Director for the Leukemia and Lymphoma Society, and I'm here to host the inaugural session of the LLS Community Ask an Expert. I am a board-certified family physician. I am a chronic lymphocytic leukemia patient diagnosed in 2010, and I am the principal investigator for the LLS National Patient Registry, whose current focus is COVID antibody response to vaccines. LLS presents Ask an Expert to create a weekly dialogue with LLS community members regarding topics of interest, to address the questions posed by community members, and to allow for blood cancer experts to share educational information with the community. Today, we will cover 4 questions related to the COVID vaccines. Let's get started. Question number 1. If there is not that much research on blood cancer patients and the COVID-19 booster vaccine, why should I get one if we don't know its effectiveness? We can answer this in generally 3 terms. 1, we found in the early COVID experience that blood cancer patients are highly susceptible to poor outcomes. Through our LLS National Research Registry and analyzing thousands of our constituents and their response to the vaccine, we have found that 75% of blood cancer patients have an antibody response to the vaccines. And reports of blood cancer patient hospitalizations and deaths after vaccination are now very rare. Question 2. What are the common side effects for blood cancer patients receiving the COVID-19 booster vaccine? Well, I'm going to put up this chart for you that describes our look at the common side effects with the initial series of vaccines, and then the side effects of the 3rd dose of the mRNA vaccines. The initial series was done looking at 3,600 patient responses, and the 3rd dose looking at 2,400 patient responses. And you can see that in general, these side effects, if you will, are the same as has been reported in the normal, healthy population who are receiving vaccines. So sore arm is top of the list, and it goes down through tiredness, headache, muscle aches and pains, feeling unwell, injection site pain, fever, and redness in the arm. Question 3. I have heard that when undergoing treatment with rituximab or venetoclax, I am not likely to have a response to the vaccine or booster. If true, what should I do? Let's split this question up, and let's first look at the response to these drugs. And unfortunately, the anti-CD20 treatments, obinutuzumab and rituximab, really have affected the response to the vaccine. And the way this chart works is that a seronegative response means that these percentage of patients did not respond to the vaccine. So with obinutuzumab, 90% of patients that we studied did not respond to the vaccine, and this seems to be long-acting, as does the rituximab problem. By long-acting, I mean 6 to 12 months and potentially longer. With the BTK inhibitors, acalabrutinib and ibrutinib, the responses are somewhat better. You can see on average 50% of patients have a response and 50% do not. We have a very small subset of patients who have been on venetoclax, and in general, only 20% of patients on venetoclax do not have a response to the vaccine. Now, having said that, we know that many patients on venetoclax are paired with an anti-CD20 drug, such as rituximab. And when you pair those together, the response to the vaccine appears more like the anti-CD20 treatments. This is problematic. Well, what should I do? So LLS is not in a position to give specific medical advice. We strongly encourage you to talk to your healthcare provider team. And if appropriate, we encourage you to continue your treatment. We do not believe it's good to stop treatment for a very short period of time to have a vaccine. And bottom line is our mantra here at LLS: get vaccinated and act unvaccinated. Question number 4. Should I get the COVID-19 booster if I showed no antibody response in prior tests after receiving the initial vaccine doses? Another very good question. And the answer to this is a wholehearted yes. You should get a booster. We know from the CDC at their meeting in middle of August that they approve boosters for any and all immunocompromised patients. And from our perspective, every blood cancer patient really fits into the category of being immunocompromised. So please go ahead and get the booster. Now, I should say that third doses and boosters are terms that are used interchangeably, so it could be a bit of confusion. In our study, which was recently published, when we look at blood cancer patients who received the booster, the good news is that 55% of blood cancer patients who were seronegative, meaning there was no antibody response to the initial set of mRNA vaccines, did in fact respond to the booster or the third vaccine. This is very helpful and very good. However, the response to the booster shot was dulled primarily by those who were on therapy with anti-CD20 compounds, as we've mentioned, primarily known as rituximab or obinutuzumab. But please go ahead and get the third dose. And by the CDC recommendations, if you were to be getting your initial vaccines, meaning dose number 1, the schedule here is to get dose number 1, and then depending on if it's Moderna or Pfizer, to get dose number 2 in 4 or 3 weeks respectively, and then get dose number 3 again in 4 or 3 weeks respectively. If you've already had your 2 doses, you can feel free to get the third vaccine shot at any time. Well, thank you for your support of LLS and your participation in the LLS community. Should you have follow-up questions regarding Ask an Expert, please direct them to the email address community@lls.org. Should you have follow-up questions regarding the LLS National Patient Registry and our COVID vaccine study, you may direct them to the email address of pact@lls.org. Enjoy your day. Thank you.